Greetings students. In today's lecture, we are going to see about few basic concepts involved in clinical masking, as such interaural attenuation, crossover and cross-hearing. The first two concepts are interaural attenuation and crossover. Crossover means the sound which is delivered in the test ear crossing over and reach the non-test ear. Interaural attenuation means reduction of sound energy when the sound from the test ear is reaching to the non-test ear. Inter is between, aural is ear, attenuation is reduction of energy. To understand these two concepts, let us imagine or look at this particular picture. During pure tone audiometry, the standard transducer used to track the threshold is supraaural headphones. At lower intensities, the sound travels into the ear canal of the test ear, the middle ear and the inner ear and stimulates only the test ear. But as the intensity of the sound increases, the vibration amplitude of the diaphragm also increases. At a particular intensity level, what happens is that the amplitude of vibration of the diaphragm in the transducer is greater in such a way that it can induce the vibration of the encasement of the transducer. So whole transducer starts to vibrate. As the transducer is placed against the head, this vibration can induce bone conduction hearing. Once this bone conduction hearing is induced at a higher intensity, not only the cochlea of the test ear but also the cochlea of the non-test ear gets stimulated through bone conduction. This is what crossover means. And the amount of energy to initiate this bone conduction hearing is called as interaural attenuation. So we need some amount of high intensity sound using supraaural headphones to induce this bone conduction, and crossover will take place at this particular point. Let us see what happens with bone vibrator. Bone vibrator's main or basic physiology is to vibrate the skull bones. Once the skull bones are vibrated, both the cochlea are located in the petrous part of the temporal bone, which is a skull bone. So both the cochlea get stimulated at the same time whenever the bone vibrator starts to vibrate. Hence, there will be 0 decibels difference between the activation of both the cochlea. Hence, the IA for bone vibrator is 0. Let us see what happens with respect to the insert receivers. In insert receiver, the vibratory part is encased in a small box that is going to be placed away from the head. This is the transducer part. The sound produced from this transducer is routed via the tubing and is delivered into the ear canal through the foam tip. The foam tip will be placed in the ear canal, whereas the vibratory transducer is going to be kept outside the or away from the head. Hence, we require very high intensity of sound in order to induce bone conduction hearing. Hence, the IA for insert receivers is going to be much more higher compared to that of the supraaural headphones. Understanding these things, we should know what is the minimum IA for different transducers. Bone vibrator, as it vibrates the whole skull, whenever it starts to vibrate, it has 0 dB of IA. Whereas supraaural headphones, the auricle cartilaginous part, the skin, the adipose tissue absorb some amount of vibration, so it requires minimum 40 dB to overcome these absorptions and induce bone conduction hearing. And insert receivers require minimum of 70 dB in order to reach the other ear. So in order to have crossover, you require at least 70 dB. Now let us see what is cross hearing. To understand the physiology of cross hearing, let us see an example with this particular image. So here we can see supraaural headphone is used and the test ear is going to be the right ear, non-test ear is going to be the left ear. Let us assume that the test ear is severe to profound and the non-test ear is normal hearing, with the air conduction threshold to be 15 dB and bone conduction threshold with 10 decibels. Now the sound has to be delivered at the test ear, and this is called as presentation level. So presentation level is the level of sound delivered in the test ear. Now we know that as it is supra headphones, the internal attenuation is going to be 40 decibels. If the presentation level is going to be greater than the internal attenuation, then the sound energy will reach the other ear through bone conduction. So that is called as crossover. So whenever the presentation level is greater than IA, crossover takes place. If this crossover sound is greater than or equal to the bone conduction threshold of the non-test ear, then cross hearing will take place. Let us see this with an example. Now IA is going to be common because we are going to deliver sounds only through supral headphones. And the presentation level is going to be 10 decibels at the test ear. As it is less than the internal attenuation, there will be no crossover, hence no cross hearing. When we increase the intensity to 30 dB in the test ear, still it is less than the internal attenuation, hence no crossover and no cross hearing. When we increase it to 40 decibels, it is equal to IA. So there will be 0 dB of crossover. Now this crossover sound has to be compared with the bone conduction threshold of the non-test ear, which is 10 dB. Now this crossover sound is less than the bone conduction threshold of non-test ear. Hence there will be no cross hearing. When we increase the presentation level to 50 decibels, the crossover sound is going to be 10 dB, which is equal to the bone conduction threshold of the non-test ear. Hence, we can suspect some amount of cross hearing at this particular level. So this is happening at the non-test ear. So when the subject tells that he is hearing the sound, it is not from the test ear, it is from the non-test ear. At 55 decibels, the crossover sound is going to be 15 dB, hence cross hearing is going to be 5 dB. So in these two conditions, the subject will hear the sound because of the activation of the non-test ear cochlea. Now if I want to find the true threshold of the test ear, I need to avoid the participation of this non-test ear. Hence we need to provide noise in the non-test ear in order to elevate the threshold of the non-test ear cochlea in such a way that we will be able to get the true threshold of the test ear. This is the need for clinical masking. In summary, cross hearing will always take place through bone conduction because crossover route is through bone conduction. Even though we use supral headphones on bone vibrator, always crossover will take place only through bone conduction. And this crossover sound, if it is greater than the bone conduction threshold of the non-test ear, it results in cross hearing. And this cross hearing depends on internal attenuation as well as the bone conduction threshold of the non-test ear. If the internal attenuation is higher, there is very less chance for crossover, hence cross hearing. If the internal attenuation is very low, then there is greater chance for cross hearing to take place. This internal attenuation depends upon the type of transducer we use as well as the frequency of the sound stimuli. There are some individual variations between subject and subject. With respect to transducers, we know that bone vibrator has 0 dB of IA, hence there are maximum chances of cross hearing to happen. With respect to insert receivers, the IA is greater, closer to 70 decibels, so there is very less chance of cross hearing to occur. With respect to frequency of sound, low frequency sounds can easily cross over through bone conduction and high frequency have lesser chances. I hope these concepts are pretty much clear and this will be helpful for understanding the clinical masking. The references are taken from Martin and Gelfand. Thank you.